each of you to this Eastlake High School parent education event. I am really grateful that you showed up. I hope that this evening we'll be able to give you information that you'll be able to find useful and will be able to take home. Tonight's event is brought to you by the Eastlake PTSA, and we did this in partnership with the Lake Washington School District, the Lake Washington School Foundation, and the Center for Child Development. My name is Jennifer O'Donnell. I am an Eastlake High School PTSA member. I work with family and community engagement, community liaison, and parent education. I am the mom of 2 Eastlake alumni. I am the mom of the current junior. I am a board trustee member for the Lake Washington School Foundation. I'm a retired social worker. Most of all, I'm passionate when it comes to youth and their mental health and their mental well-being. So tonight, my goal is that we can better educate ourselves in regards to understanding our teens so that we can help better guide them and support them as they enter into adulthood. Tonight, we will look at topics involving mental health and mental well-being, some trends, some potential red flags, and ways to support our teens. We'll bring to you tonight an umbrella presentation, and by umbrella, I mean we're going to be bringing you speakers from the community at large, also within our school community here at Eastlake. I know some of you may not be from Eastlake, so I'm really interested if we could just do a little hands up right now to see if we have any families from high schools other than Eastlake. Awesome, welcome. Thank you for coming over here today to be with us. We had put out communications to all of our high schools within the district, hoping to get some of our parents from each of them. So I want to welcome each and every one of you. I'd like to begin our event tonight with an introduction of 2 professionals from the community. They're coming from the Center of Child Development. I have Dr. Holly Stafford and Dr. Tasha Willis. And they are board-certified pediatric nurse practitioners with Doctors of Nursing Practice degrees from the University of Washington. They each have over 10 years of experience within pediatrics and are now fully specialized in child and adolescent behavioral and mental health. So I would like to welcome both Dr. Stafford and Dr. Wills up to the podium as you would like, and thank you for coming. All right.
Thank you, Jen, and welcome everyone. Thank you so much for taking some time out of your evening to join us here today. As Jen mentioned, Dr. Wills and I have been working in adolescent mental health for years now, so this is a topic that is near and dear to our hearts, and we recognize the crucial role that you as caregivers and parents play in the mental health of adolescents. So we hope you find our information useful and you can walk away with some resources tonight. Just real quick, the goals for my talk tonight is to review the current trends in adolescent mental health so that you're aware of what's going on. And then to hopefully have a better understanding of the milestones and age-appropriate behaviors that you might be seeing in your adolescence. And then recognize what might not be appropriate and what could be a warning sign. And then learn about the best practices and some treatment options that might be available to them. And know how you as caregivers can provide the best support to adolescents at home and gain some of those tools. So let's talk about the mental health crisis that's happening, because it is absolutely impacting our adolescents. Nearly all indicators of poor mental health raised from 2011 to 2021 in adolescents. About 50% of adolescents suffer from a mental health disorder during their teenage years. ADHD, anxiety, behavior problems, and depression are the most commonly diagnosed disorders. And rates for each of these have actually increased even more so since the pandemic in 2020. So why is this important? Well, we know that our mental health affects many areas in our life. Poor mental health can affect our ability to focus our work performance, our motivation, our social relationships, our decision making, our physical health. So it's really important to make sure that we are in a good mental health for other areas of life. We also know that poor mental health in adolescence often also leads to poor mental health in adulthood. Furthermore, adolescents with poor mental health are more likely to engage in risky behaviors. So they have higher rates of STDs, unintended pregnancies, of substance abuse, of violence, and so on. So every 10 years, the CDC publishes a survey called the Youth Risk Behavior Survey. This was last published in 2020, and the data here really brings to light the level of distress that many students are facing right now. U.S. high school students in the last 12 months, 42% reported that they felt sad or hopeless for more than 2 weeks. Nearly a third, 29%, experienced poor mental health. 15% had a major depressive disorder. And furthermore, suicidal ideation and behaviors increased. And these rates increased among all groups, all racial, ethnic groups, all genders. We do know that some groups are affected more than others. The mental health disorders tend to be more common among LGBTQ students, female students, and minority groups, Hispanics reporting more sadness and hopelessness, and then Black students being more likely to attempt suicide. In 2022, the National Education Association did a survey of parents, and so this is what the parents are seeing at home. 73% of parents said that their children could benefit from mental health counseling, and unfortunately only a portion of those actually got the counseling they could have benefited from. 19% of parents said children have symptoms of anxiety, and 12% of them said their children have symptoms of depression. So you as parents and caregivers are very much in a pivotal role, in a good position to identify when a child is not doing well and to be able to implement and provide the services and help that they need. Real quick, I wanted to touch base on youth suicide because this is a trending problem that is growing. Suicide is now the second leading cause of death in adolescence. First leading cause is accidents. In that same survey, U.S. high school students in the past 12 months, 22% of them seriously considered suicide, 10% of them attempted suicide. Girls did have more suicide attempts, but boys had a higher fatality rate, about 3 times, and that's because they tend to choose more lethal methods. There was a slightly higher risk in 9th and 10th graders, and there you can also hopefully see some of the suicide risk factors that we'll dive into again more once we talk about some of the red flags. There is a little good news in this, and that is that most suicidal thoughts do not lead to suicidal attempts, and the rate of death among attempts is relatively low. There's about 1 death for every 100 suicidal attempts. So moving on to adolescent development here, I want to talk a little bit about what might be normal and appropriate behaviors, and that will see some of those underlined. Let's get a better understanding of the brain, because there's a lot of brain changes happening at this age. The prefrontal cortex is responsible for decision making, for impulse control, and for planning. And that is not fully developed until we are in our mid-20s. And so it is very likely that adolescents tend to be a little more impulsive, might be willing to take some more risky behaviors, and maybe not make the best decisions. Cognitive development is also happening, and that's because there's a lot of abstract thinking and critical thinking that's developing. During adolescence, we have a better understanding of our hypothesis, and we begin to think more independently, and therefore maybe question authority. There's a lot of emotional development happening too. Adolescents are still learning how to manage and regulate their emotions. And that's challenging because of all the changes that are going on, not only in their brain and their bodies and hormones, but also a lot of changes in life and friendship. And so it is something where you do often see adolescents tend to be a little more moody, maybe going through those mood swings, and that would be also expected. There's a lot of social development in adolescence. Adolescence place a significant emphasis on their peer relationships, and they're maybe more influenced by their peers. So maybe you feel like your adolescent isn't listening to you, and that might be the reason why. Furthermore, they're striving for independence. They want to do things on their own. They value their privacy. So while it's important to be involved and supportive, it's also important to respect boundaries and not pry excessively into their personal lives, and that will help you build trust. And then also, the development of identity is happening. This is a time to figure out who you are. It's a crucial stage for exploration and testing your limits and developing your values, beliefs, and maybe goals in life. And so you might see interests change. You might see some ups and downs with that, or changes in what they're into, and that would also be considered appropriate. I'm going to turn it over to Dr. Wills here, who's going to talk to you about some of the behaviors that might not be appropriate.
Some of these are going to kind of clash a little bit. So one of the biggest things that we tend to see is a lack of motivation. So we used to be wanting to work and wanting to strive to get good grades. And we're just not seeing that same motivation that we were. Along with that, they tend to be a little bit more tired. Not everybody gets really tired, but we do tend to see it a little bit more often. So napping during the day or complaints of being tired, even after a full night's rest. Outbursts. This is where we're going to kind of clash. So easily annoyed and irritable is kind of the big key words that we tend to use. And we do see easily annoyed with parents. That's normal, right? But are we seeing it more consistently, right? Are we seeing it with everything? Are we starting to see it with friends and our peers as well? That would be a red flag. Appetite changes. So some people might eat a little bit more because they're trying to soothe themselves, and other people might not have an appetite at all. So either one of those would be a red flag. Withdrawal. So they used to be really interested in things, and now they're not really wanting to go and do things socially with friends, or we're not really seeing the same joy in events and things that we used to do anymore. And so that would be a big red flag, pulling away. Saying that they're sad or down. Often it tends to be sometimes for like no reason, right? I just feel sad, I don't know why. And sometimes we can also see crying for no reason, waking up and feeling sad and not knowing why I'm sad. I'm just kind of sad today. Academic success regression. And so with that, that is, we tend to see with that lack of motivation, our grades start to kind of slip. We're not turning in assignments, we're not trying anymore. Low self-esteem or like negative self-talk. I'm so dumb, I'm not smart, I can't do this, those types of things. Substance abuse, right? Especially if they're doing it alone. That's a big red flag. Peer conflicts, bullying, or loneliness. Ask your child, do you feel lonely? That's a big question because that is a predictor of possible suicide. So something to really look into. With loneliness, sometimes, especially in like our world of generation of not knowing what boredom is, helping them to decipher between am I lonely or am I bored, right? Because we live in a world where everything is fast-paced. We need something, we want something, we can get it, right? And so helping them to understand boredom versus loneliness. So along with the other survey, they do a bullying survey. And within the last 12 months, we're starting to see kind some of them positive and some of them negative. About 9% of students say that they don't want to attend school because they don't feel safe. And so that one, if you can see, it's kind of trending in the upwards direction. But to go along with that, we see a downward trend in a positive manner for 15% of people are getting bullied at school. And so that is down from 20%. So that's a good thing. The schools are starting to really recognize and do something about that. Cyberbullying. This is the new big thing, right? 16% of students say that they've been cyberbullied in some way. And so that's something that we're all trying to learn to navigate, how to approach those things, and it's all changing, different apps, different ways to do it, and so that's kind of an ever-evolving process. And then 11% have experienced some sort of sexual violence. So what are things that we can do to help them? So prevent social isolation. Encourage them to go out with friends, go to football games, do things, get out, join sports, join after-school activities, get out socially, okay? That's different than I'm going to stay home and play my video games with my friends online. That's very different, right? We want them to get out and be social. School problems, academics, attendance, and behavior. So this is kind of like a snowball effect that tends to happen. And so if we can find the underlying cause of, why aren't we going to school? Why are we trying to do some school avoidance and not trying on our grades and things? Substance use, improper media coverage of suicide and mental health. So we're doing a great job right now of trying to break that stigma of mental health. And so by talking to your kids about it and being open, that really helps in those instances. Lack of support by their community, parents, peers, faith, all of those things. You are a pivotal role in their lives, and so you being there to support them and give them the resources that they need is just as important as us in the community. The biggest one is excessive screen time. So taking away their phones, right? It's always the big thing. So excessive screen time use is anything greater than 5 hours. Used to be 2, now it's 5. And so being able to help them to, again, be social outside of screen time is extremely helpful. Treatments. So first-line treatment is therapy. Okay, there's different types of therapy depending upon kind of what's going on. There's CBT and there's DBT. Both of them are different types of talk therapy. But first-line treatment is therapy, so seeking out a counselor or a therapist, psychologist, any of those are great resources as first-line treatment. Sometimes it's hard to get into a therapist, right? And we're struggling right now. And sometimes our anxiety or depression is so high that even if we learn therapy, those coping strategies and coping skills, we're just not picking up on them because we're so anxious or we're feeling depressed. So we can start some medications to help to decrease the amount of anxiety or depression that they're feeling, to then have them use those coping strategies and skills that they've learned in therapy to make it a little bit easier. I could go on and on about medications, but I'm not. So there's different types. There's serotonin reuptake inhibitors, and then serotonin or epinephrine reuptake inhibitors, and then there's a few that are considered in the category. The biggest thing that you should take away is if you ever feel like your child's safety is at risk or your safety is at risk, then seeing the emergency department would be the very first place to go. They will do a safety assessment, and they will make sure that your child is safe and then either discharge them, or if they're not safe and they're worried, then they'll keep them inpatient and start either treatment or also get you resources. So set you up with a therapist and those types of things before discharging from the hospital. What can you do? The biggest piece that you could do is talking with your child, having an open and honest conversation. How was your day? Are you feeling lonely? Are you happy? All of those questions seem pretty basic, but they go pretty far. Listening, because sometimes as parents, we also want to give our opinions and we want to help and we want to, fix it, right? And so sometimes that's not the right time or the right place for it. And so if we just listen to them, that helps a lot. They just sometimes just want somebody to listen to. Some of the best places that I tell parents to listen is and talk to their kids is in the car. That's a really good one because they don't have to make eye contact with you, right? So you're in the car, you're driving, and just chatting. The other place is at bedtime. Going in to put them to bed. Sometimes we don't do that with our teenagers, but if you're putting your kids to bed and the lights are off, that's another time we're not making eye contact either. And so that's another really good time to listen. And if they do mention, right, that they are feeling sad or depressed or anxious or those types of things, then just make sure that you tell them I'm listening, I've noticed, I'm here to help you. Just give them lots of reassurance because that is extremely helpful. Encourage a healthy lifestyle. So we also want to be the role models for this. So if we're really anxious, we're going to feed off of our anxiety as well. And so you want to lead by example. And I know there's that, goodness, I do what I say, not as I do. But it really helps, right, for you to be that role model for them. So encourage the kids to, get up and take showers every day and get dressed, right? So that's something that can help change their mood in the morning. Exercise, 30 minutes of exercise every day. And exercise means like getting your heart rate up greater than 120. Sometimes it can just start off as like just going for a walk outside, right? Just getting out. Eating a well-balanced diet. This is teenagers' favorite thing to do, eating well-balanced diets. So just encourage, right? Make dinners or, help them to like learn what a well-balanced diet looks like. And sleeping at night, 8 to 10 hours. That goes against their circadian rhythm in the high school schedule. But that is a goal, right? At least 8 hours of sleep at night. So we know that kids are involved in sports or after school activities, maybe have a job, and then they have homework and studying. And so they tend to get to bed really late and then wake up really early. But encouraging them to have good time management skills, prioritizing, themselves as well. Again, encouraging social interactions, teaching resilience. That's a pretty big one. So to build resilience, helping them to set goals for themselves, as well as holding them accountable, right? So if they were supposed to take out the trash or they were supposed to feed the dog, hold them accountable to that. Because as much as they might hate it in the moment, down the road, that's going to build resilience because they know what they need to do and what they need to be held accountable for. And then positive rewards. So encouraging the good behavior with some sort of reward system. Maybe it's, just time with you. It doesn't have to be monetary in any way, but positive rewards really help with that. Encourage them to meet with a counselor. That's a big one. And then build in some downtime. Our adolescents are so busy. They are worried about colleges and applications and their volunteer time and what college they're going to get into and all of these things and sports and so having some downtime built in every week is just as important as their volunteer time and their to do. Here are some tools for you guys. The last one is Seattle Children's Mental Health Resources. That one has a whole bunch of different resources. We've also printed out some handouts up front for you to better understand anxiety or depression, ADHD, and then just some tips for parents and things that you guys can do. And then the crisis line, of course, 988. They can text and call 24/7. They remain anonymous. It's just someone that can help when they are feeling kind of low and at their low point. That's it.
Thank you, Dr. Wells. Thank you, Dr. Stafford. Appreciate you guys taking the time to come and talk this evening. We're just going to switch over some slides and we'll go on. To provide leadership and oversight of the programs and services that support student academic success, student safety, student social and emotional well-being, and he provides oversight of district counseling services, district attendance, drug and alcohol prevention and intervention programs, as well as other areas of focus. He is dedicated to shifting educational systems towards incorporating well-being at a full scale. He works on this through multi-tiered systems of support, mental health programs, social and emotional learning, working with equity measures, and positive behavioral supports and interventions. So, let me try the button. So he works at the district level to create comprehensive frameworks that support the holistic development of students. In the presentation he gave, he stated his student service mission is to ensure that each student attending the Lake Washington School District feels that they matter to our community, that they belong to our community, and that they are safe within the community. He has a goal within our district to destigmatize talking about and addressing mental health. Students are way more just important than the diagnoses that they receive, and he sees how important that is, that they are recognized as the humans and wonderful people that they are. In talking about social, emotional, and behavioral health, it's a very tied-in thing. That is education. This is so much of what happens within the district. And they assess at the district level and at the school levels this in a variety of ways. They have healthy youth surveys, they have panorama education surveys, and they also have other district tools. Johnny stated that at the schools and within the district, they have, like we were talking about, noticed a lot of disruptions and changes since the pandemic in our high school students and their behaviors and how they manage them with the students. And you can see on this slide some of the disruptions that are noted. They've noticed, as far as the district, they are working at looking at some of the concerns because of the disruptions that have occurred. Schools have been approaching their caseloads and individual student capacities. They've noticed that the acute needs of students have intensified. They've noticed an increase in substance use in middle school students. And they're noticing that at the school level, there are tiers in which students are recognized. There are tier 1s and tier 2s and tier 3s, and we'll get into this a little bit. And what they're noticing is that the time invested in tier 1 and tier 2 students means they're increasing. So tier 1 is a system. You can read about this right here. And the tier is, they look at it and they can all be this can also all be found on the LakeWashingtonSchoolDistrict.org, lwsd.org, under the student services and more specifics. But the schools each talk about the different tier levels. Tier 1 is the response to instruction and intervention, including strong core instruction. So all students get Tier 1 supports in these schools. Tier 2 is an extra academic support for students who are not thriving or responding well to the core instruction. They need a little bit more support. And I think some of our staff here will be able, they talk about this, bring this into a little bit more detail. Tier 3 are the individual students that help is really required because they have more severe and persistent needs. So there are 3 tiers when it comes to this. Some of the main components of the multi-tiered system of the support are measurements which are universal, they're evidence-based, and they're reliable. Johnny shared that when it comes to Tier 1 and Tier 2 supports, Lake Washington School District at the middle school level had over 15,000 connection points across the schools, which includes screenings, community connection and referral, mental health education opportunities with students, families, and staff, suicide prevention, and school team collaboration meetings. When it comes to Tier 3 supports, there were a total of over 3,300 service hours provided. That meaning that there were 33 suicide risk assessments done, there were 110 safety plans developed, there were 23 elementary suicide risk consults, and 445 individual with 3 or more mental health counseling meetings with students in need have occurred as of late. This is concerning to him. He wants to make sure that the schools are addressing these things, and the district is working very hard on that. Lake Washington School District is adding supports within our schools. We have contractual services to help out. Currently, Lake Washington School District partners with outside sources to help provide assistance to our students and families. And these partnerships all have similar goals in mind. Currently, some of the things that the district works with are UV Site Services, Evergreen Health, UW Smart Center, and the Root Device. One of the things that Johnny has mentioned is full-time mental health clinicians are now at the middle and high school levels, and you'll have the opportunity to hear from one of those professionals today. They have seen that the acute needs of students have intensified, with up to 50% of our students having expressed thoughts of having anxiety and depressed moods, which follows what you have said earlier today. There are limited community availabilities of services to address ongoing student needs in a timely manner, and this is something that I know Johnny at a district level is working very much with and partnering with these community contractors as well, so that we can keep providing for our students in schools and within our district. And I know that Johnny is really proud that the mental health and school counselors are working really hard with the administration and doing amazing jobs right now to their best abilities, and they're busy working, making plans to improve and make more partnerships and collaboration for our students by being on site and in the schools. He has stated that goals for the 2023-24 school year, as far as key development goes, is to continue building the work of the foundation that has already been done from previous years. He wants to do more studies to collect more data. He wants to continue professional development with school counselors and administration. He wants to continue building on the organization and alignment within the schools in the district. He has some expectations because of these things. One will be a more clear understanding of counseling duties and responsibilities and needs that our students would have. Continued and increased in collaboration between the schools, the administrations, and the counseling departments. and to continue developing programs to improve our current supports within the schools, and to test some pilot programs within certain schools as well. And this is all work that is currently being done. He states there are still gap areas being worked on and more partnerships being worked on within the community. So much is still being explored. So those were some of the highlights in which he had given to me to share with you. Again, if you want to understand more of this, if you go to lwsd.org and click on Student Services, you will see a whole bunch of the surveys that have been done, the outcomes that have been produced, and you can read more about the work that he is doing. I'd like to keep this moving. I have my next guest works in partnership with the Lake Washington School District. Katie Phillips is currently the Executive Director for the Lake Washington School Foundation. She is responsible for the planning, the organization, and overall direction of the foundation programs and their resources. Whether it's online, in person, on YouTube, or just here tonight, she is working to make sure that the foundation provides our Lake Washington School District families and students additional support and assistance. So Katie, I'd like to welcome you up to the microphone and thank you for being here.
And thank you, Jen, for standing in for Johnny and that presentation. Thanks. And then just try to get the technology right here. It's a pleasure to be here with you tonight. Thanks for spending some of your free time here to learn more about how to support students, either yours or in your community, with their mental wellness. I had a video here, but we realized that the technology isn't connecting the way that we were hoping. So we're going to pass that and move right on. So just to give everybody here just a basic understanding, Lake Washington Schools Foundation is a nonprofit organization that is a separate organization from the school district. And we have been in existence for over 15 years. I think we're going on 17 or 18. And our mission is essentially it's to gather and deploy community resources to enhance academic access and to nurture all students' emotional well-being. And what that means is we're here to support in alignment with the school district and with the PTSAs. We are another partner that's here to provide resources that students need that they may not be receiving. And we do that by reaching out to raise money through individual donations, through corporate donations, and then also through grants. Some of those are from the cities and other organizations. I'm just going to provide just a quick overview of some of the programs or the funding initiatives that we're currently supporting in the district. I told Jen, I'm happy to talk about the work we're doing. We're proud to be part of hoping to be that we're being a solution to improving student mental wellness in the district. That being said, I'm not a mental wellness expert, so I'm really glad that we've got some of our other folks here who really have that expertise. One of the resources that the foundation provides currently and has for the past, and we're entering either our third or fourth year, we provide youth mental health first aid training to all the staff at the district. That's teachers and anybody who works for the district. We cover the cost of that, and then we've also worked with the district so that teachers can also receive some of their continuing education hours when they take this class. So far we've been able to partner and train over 300 staff and teachers at the district over the past 3 years, and we're hoping to continue that work. We've also added, it's an 8-hour course, And one of the things that we've realized is that that's just the teachers and staff are busy. And so we've actually recently been piloting a 2-hour course that's a more targeted suicide prevention course. And it's also offered completely free of charge to interested staff and teachers. We've also provided funding for a version of that youth mental health first aid training that is directed directly to teens for them to be able to support their peers. And this rolls out a little bit differently. It rolls out school by school, and we've been able to pilot it and offer it at some of the smaller choice schools in the district, and are working with the district to roll that out to more schools. But because it's a school-by-school basis, it's a little more complicated to provide that because it's just getting an entire school finding the time to implement that. But we've been working with Johnny Fu and with district leaders to continue to try to roll that out and offer that to students. Last year, we were providing funding to every high school in the district for them to be able to build or provide or supplement spaces that are calming corners so that students, and these are typically near the counseling office, and there are a variety of materials that students can use, and it's a space for students to come to if they need to just calm down or just take a minute. So that was something that, in conversation with school counselors, we heard that there was some need there, and we were able to provide funding to supplement either the spaces they already have or to help create them. We offer bi-weekly free parent chat webinars. You can get onto under our website, or a lot of times they're publicized in our newsletters or in Peace Jar flyers. And they're on a variety of topics. Typically, they're topics that either tie to the time of school year that we're in, stresses or issues that might arise with for students at a certain time of year, or they might be in current emerging issues around mental health. And you can, all of this information, if you want to be more tied into knowing about what the foundation is doing, you can always sign up for our newsletter if you don't always already receive that. And then we just started piloting this year parent social emotional learning workshops for parents. So if that's something that might be interesting to you, please, again, take a look at our website. We just completed our first virtual training, and we're in the midst of our second in-person training. And we've had some really positive feedback. So these are skills for parents to just provide foundational knowledge and strategies around some social emotional skills that of their own, and then how that can impact the parenting that they're doing. And I've got a couple of QR codes here. If you want to subscribe to our newsletter, make a donation. All of the work we do is funded through donations, sponsorships, and grants. That's it. Thank you.
Thank you, Katie. I appreciate you coming to talk this evening. Our next guest tonight is Todd Apple. He's our head administrator at Eastlake High School. He is a wonder advocate for our staff, for our students, and for our families here within the Eastlake community. So Todd, welcome, and thank you for joining us this evening.
Thank you, Jen. And thanks, everyone. I'm glad you're here. And one thing I didn't think about in preparing for this, but I was thinking about the last half hour. Before I went into education, I was a corrections officer in a county jail for a while. And a lot of folks that are in the jails are not necessarily evil people trying to do harm. A lot of them are folks with mental illness and of some type, and our society just isn't set up too well to work with adults in all the ways that they could have. But high schools have a lot more support, a lot more infrastructure, a lot more ability to reach students, and there's a lot we can do, there's a lot we need to do still, but there's a lot we can do and are doing. About 2 years ago, I attended a meeting with about 20 King County high school principals. We meet once a quarter and we go through, what's going on in athletics and some other normal type agenda items. But 2 years ago, at the end of the meeting, everyone's standing up to leave, and one principal just spontaneously said, "Hey, are any of you seeing problems with students who go to school on time, but then they don't stay in classes?" And that sparked a really rich conversation. We all were seeing that, and we had no idea that it was in all of our schools. And this had to do with what you already heard, the impacts of the pandemic, where students went home and they didn't have the socialization that's healthy and needed. And they came back to school and didn't know how to do school. A lot of them did. A lot did, but a lot didn't. And some students were just in the hallways. They couldn't be in class for an hour and a half at a time. And we had groups of students who would go with their friends in the bathroom and stay in the stall and just sit on the floor in the stall together for a while, every day, for extended periods of time. And what none of us knew until we met and started talking was every school had that. And then we eventually started reading that it was every school in the country, and all of us at first thought it was, is it only Eastlake? Is it only this year? And it was much bigger than that. And now we're a couple years later, and most of our students, most of us have recovered from this, but some haven't. And sometimes it's easy, sometimes it's hard to see who needs the help and in what way. And I want to tell you about one of our students, and I like to think I'm pretty good at helping students and families with the different situations. When I go home, I don't always know what to say to my own kids, but I'm pretty good at helping other folks sometimes. But there's maybe every year or two, there's a student that situation that really grabs me and I can't let go. And I'll tell you one I'm thinking about all the time right now. And this is a girl I've never actually met in real life. And in 9th grade and 10th grade and first semester of 11th grade, she was a straight A student taking challenging classes. And last year as a junior, halfway through the year, things started to fall apart with her. And she started to have anxiety about being in school, and she started not attending her classes. And her parents would actually drive her to school, but sometimes they'd be in front of the school, and then she'd say she can't do it, and they'd drive home. And the attendance got pretty bad, and she finished the year, and not straight A's anymore, but she finished the year. But now she's a senior, and she does have a really solid academic foundation, so she signed up for some tough courses, and I don't think she's been here for a day yet. And I think she's making some progress in some classes, and she's not making some progress in some classes. And what started out, I think, as a feeling of loneliness has turned into anxiety with some physical manifestations that's really tough, and it's really sad, it's really horrible. And I don't know everyone's story, but I know a lot of her story. And I'm not a mental health practitioner, but I am in a position where when I start to learn some of the stories, I can sometimes match families up with folks who can help, or at least get folks pointed in the right direction, and hopefully there can be help. And hopefully we can make an impact. But this girl right now, we're not quite there yet with her, and we're trying. Part of the struggle with her and her family, they immigrated here, I don't know, 5-6 years ago. So I think about 1/3 of Eastlake parents are immigrants. And that is a different complexity because not everyone knows what resources we have or how we can help. And for some countries that our families come from, there's different stigmas. It's hard to even talk about some of the problems that are normal for a lot of families. But that's a challenge we have, and we're thinking about it, and we're wondering, how can we make things better? But we have to try. One thing we have here that can help is we have a social worker, and all of our 4 large comprehensive high schools like Eastlake have a full-time social worker. And it's not a district staff member, it's at Evergreen Health. And we also have a drug and alcohol counselor. And she's also not a district staff member, that's through the Eastside Services, YES, but she's here, she helps our students with substance abuse. And then she can help parents too in context. If you're seeing some of this at home or have questions, and she can talk with you about what's normal or what's not, or what's trending in our county or community, and give you some context too. And we also have our school counselors. And our school counselors help a lot. They give advice for what classes to take, but they also help with social or emotional challenges that our students have. And sometimes it's lower level things with friends or with family or classes that are hard and they sign up for and they don't know if they can make it. But sometimes then they realize that the problems are greater than that, and then they can maybe turn to our social worker or a different type of specialist or talk to parents about the greater needs that their kids might be having. But they also do a lot to try to give information to students. And they visit our health classes that all the ninth graders are in. And they have different wolf time sessions that students can sign up for to talk with them. And in our hallways, we have some posters, and the posters say, "You matter." And it's got a little bit of language about mental health, but then there's a QR code. And if the student uses their phone to sign in that QR code, it takes them to our counselor's website, where there's lots of information and resources that they can access, and they can start to maybe point themselves in the right direction. And they also have something that they call a toilet talk. And what that is they go in our bathrooms, the student bathrooms in the stalls every month, and they put flyers up, and it's different information every month. In October, it was about bullying prevention, and I forgot what November is. November is stress management, so that's what's coming up next in the toilet talk. But our counselors do a lot, and like you just learned from Katie, we have the calming room, and that's in the counseling center. There's lots of beanbag furniture in there, there's art supplies, and at any given moment, there's 0 or 1 student in there. There's not like lots of students that go in every day, but it's there for some students when they need it for part of a class period, maybe to help them get themselves together so they can go back to class. So everything we do in school is meant to be temporary to get them back into class. The counselors have a lot, and in a moment, one of our counselors made a video, a PowerPoint that you can see to learn more too. Also, all of us staff members have our ID badge, and students have ID cards, and the front's a little different from staff to student, but the back is the same for all of us. And on the back of all your students' ID cards, it's got the phone number for our Eastlake main office. It's also got a police phone number, but also the 24-hour crisis line, the National Suicide Prevention Hotline, Washington Recovery Hotline, and the Sexual Assault Resource Center. So every student has this, and we remind them a couple times a year that they all have this, that they carry with them. And also, not everyone knows this, but for school administrators, myself, the associate principals, we all have our own goals every year. And our school has goals every year. Our school goals are posted on our website, and our staff knows about them. Not everyone always knows about our own individual goals. And one of our associate principals, I met with him yesterday to learn his goal and how he intends to reach it this year. And he was looking at our data, and he looked at, right now we have 124 students with more than one failing grade. And out of those, he looked at their attendance, and he looked at, okay, 24 of those students who are failing classes have been absent for more than 10% of the school days. He's basically going to adopt those 24 students and learn their stories and see how they can be helped if no one's reaching out to him yet. That's his goal. My own personal goal has to do with our students. We have 71 students who are identified as multilingual, and what that means is English is not their first language, and they're not at grade level for academic English, reading, writing, speaking, and listening. For those 71 students, I'm interested in what's their sense of belonging. How well do they feel like they fit in? You know, the student I described a few minutes ago who's a senior now and not attending, she doesn't feel like she fits in. And that's what, or at least one of the contributing factors that led to the spot she's in right now that's hard to get out of. So my interest is students who English isn't their first language, they're not fully fluent in English, how well do they feel like they belong here? And if not, what can we do about it? So I want to introduce right now David McKell. And so I said we have a social worker, and it's David over here, and he's coming next. And one of his jobs is to learn that the students in crisis, how urgent is it? Is it serious and we need action now, or just the family of the student needs to be pointed in the right direction? So David's a licensed independent clinical social worker. He has several years of experience in different settings, including schools and other workspaces too. And he's part of Evergreen Health school-based social work team. And again, he responds to moments of crisis, and he provides brief interventions, and he connects students and families to mental health and other community resources. He's been here at Eastlake for 2 years, and we're lucky to have him. So welcome, David.
And my goal for tonight is just to review the partnership that Evergreen Health has with the Washington School District, tell you a little bit about what we do in the schools day to day, and as well give some guidance on if there's a situation emerging that might be a crisis or students may need additional help, what you as parents and caregivers can do to kind of figure out next steps. So to start with, what do we do at the high school? So I am personally positioned upstairs in the counseling center every day. I'm here whenever students are here. And so our team as a whole, we are providing real-time crisis assessments and safety screens to help students. And our goal here is to meet with students face-to-face and work with our school teams to determine if a higher level of care is needed. So I often meet with students if they're experiencing a crisis or things like suicidal ideation or things like self-harm, and kind of ask more questions and get some background information to determine, okay, is this a situation where we need to contact emergency services? Sometimes I've met with students who we kind of facilitate going to the emergency room for additional assessment, and that can be one way families access additional services and get immediate help. Sometimes that's not a necessary intervention, and it's kind of our role to determine what the appropriate intervention is, just because the emergency room can take up a lot of time. It can be a stressful experience, sometimes connecting and wrapping around a student, whether that's connecting with teachers or counselors or contacting parents and caregivers to kind of figure out what can we do to get this student through the day. Is some way we can help and kind of prevent them from going through that additional time with emergency services if it's not needed. So things that we can do, this looks like safety planning, kind of identifying what our students' triggers day to day, are they at school, kind of what might they be experiencing at home that impacts their mental health. What are some coping skills that they may already have and use, whether they know it or not, just things that kind of help them to self-soothe. Who are folks that can support them, whether that's friends or siblings, caregivers, parents, teachers here, like who do they go to in a time when they need to talk to someone, or counselors or administrators. And then we are in the position of offering brief interventions, so that's usually with the goal of meeting up a few times throughout the year, some longer, some shorter, just kind of depending on the student family's needs, and determining how do we help. So is that connecting with outside resources, often I'm assisting with identifying therapists for students or therapy resources, mental health resources, because it can be a large time commitment to navigate that system, often confusing, even as someone who does it every day. It takes a lot of time. You don't always get a call back from the providers you're hoping to get help from. So our team is really here to kind of try and help to expedite that as much as we can, and provide as much information about how to access those resources as we can. Here at school, I'm often meeting with students to kind of check in about how are those stressors going, kind of checking in about, have you been able to use some of those coping skills that we've talked about or that you may have already had. Maybe that's helping facilitate connecting with their counselor or talking to teachers and identifying what are some things you can do to help make the classroom less stressful or help you stay at school. Really, it's a nice intervention because we are here during the school day, and that's where we want to keep students. So if we can provide a moment for them to kind of calm themselves and de-escalate and refocus on the school day and get them back to class, that's what we love to do. Some other things that we have offered or can offer, support groups. There was a time when we were offering some for staff and for students as well as parents to get some information. We've done some parenting similar to this, as well as supporting in the event of a community loss or tragedy. Our services are available by referral, so usually we would recommend going through your student's counselor, and they will meet face-to-face. That way students meeting one of their supports, and then they kind of get some more information and determine if our services are a good fit. The other piece is they're voluntary, so making sure the student understands kind of what they're enrolling in and that we'll be reaching out and what to expect. So our goals in doing this, I kind of spoke to some, but we hope to reduce absences and the number of visits to the emergency department for students, and that's through kind of what supports can we bring into place here, kind of at this first level of intervention. Decreased rates of suicide, increased scores in the Healthy Youth Survey, as we've heard tonight. A lot of our adolescents are struggling with their mental health, and so we want to make sure that they're getting connected to the resources that they need. Improve mental health and engagement in school, and then connect students and families with necessary services and providers to improve their well-being. And another team that Evergreen happens to have is what's called CHAT, or the Community Healthcare Access Team. It's just another level of support that can help with. Also behavioral health, connecting with primary care providers, connecting with benefits, all kinds of things that we kind of have a nice access point and communication with as well. I just wanted to provide some information on different kinds of situations that might come up. So in a crisis, what do you do? So if there's any immediate physical danger, physical harm, suicide threat, drug or alcohol overdose, these are times when you'll want to get immediate medical attention. Call 911, take your student to the emergency department, and that's also something it's helpful to contact your child's counselor or anybody who may be involved at the school to kind of let them know what's going on, so we can be prepared to help them when they return. We have a process of re-entry and of safety planning and working with any community supports that students may have set up. Secondly, if you become aware of any safety concerns while a student is at school, that's a time when you want to either contact an office or admin and notify the school counselor, and then they can meet with that student and kind of triage and determine, okay, what do we do next? Who does the student go to see? And similarly, if the school here becomes aware of any concern, that's usually when administrators or counselors will be meeting with the student and getting more information and determining what the level of risk is, and contacting you as well just to keep you informed. Some kind of non-crisis situations, but situations that may still need intervention. So secondary danger, mental health challenges that might be impacting home and school, such as maybe running away from home or substance use, social issues that are impacting school. These are times when you might want to reach out to us here and we can kind of help you plan what to do next or what services or resources are available. And similarly, if there's no immediate danger or crisis, but there are concerns in the school, this is kind of where we, again, intervene and try to think of solutions. I often work with the counselors and school psychologists or administrators to kind of figure out how to wrap around and what can each of us do, because we all have different areas of specialty. And then lastly, just reviewing some of the resources that have already been reviewed. I think it's amazing that they're available on the students' ID cards as well, but just some of the crisis lines that are available, and I often discuss with students. And then lastly, it seems like the majority of you are from Eastlake, and so that's the contact information available there, and how you can reach me. As I said, I'm here when students are here, so the new schedule of roughly 8 to 3. But the other social workers are also listed there that are at the other high schools, Juanita, Lake Washington, and Redmond. And they're all available in a similar capacity to what I am. Always happy to consult with families and students and kind of help support them as best as they're able. And lastly, thank you. that is everything I have tonight. So I appreciate your time and thank you for listening.
I want to thank you, Todd and David, for coming up and speaking tonight. I appreciate you guys very much. We have one more presentation we're going to provide, and then we will be opening this up for some question and answers with our panel. Amber Owen Clifford is one of our Eastlake counselors. She was unable to make it to this evening event. She has some children and she needed to be home with them, but she did go ahead and do a presentation for us. In this presentation, she also has included resources for all of the high schools as well within our district. So we'll be starting up her presentation and then we'll be back in a few minutes for questions and answers.
Clifford, and I am one of the school counselors here at Eastlake High School. I'm going to talk to you briefly about what school counselors do in general, the different domains we support, and go into a little bit more specifics on how we help support students with their mental health, and then give you a brief overview of how you can schedule an appointment to see the Eastlake school counselor as well as the other high schools. School counselors work to support students and families in three large domains: the academic domain, personal social domain, and career domain. Well, I've listed a few of the different things we do to give an idea of how we help support students in each of these areas. But for the sake of tonight's presentation, we're going to really focus on that personal domain for how we help to support students and families in the personal area. So personal social support that is provided by a school counselor. Here's a list of just a few things we do at Eastlake that will be largely across the board in all the high schools. Again, some of the things might be a little bit more specific to our school, but in general, these are ways that school counselors help to support the personal social needs of students. The number one thing they do is provide brief individual student check-ins. We differentiate this from therapy, because our job is not to do therapy. That's going to be more where David and Neil, trained mental health counselors, and kind of come in and help support students in a more in-depth manner. But we really work to help support students with those brief interactions. So quick weekly check-ins, every other week, once a month, 15 to 30 minutes just to see how the student is doing, help support them get back into the classroom and to build access their learning. So we kind of work with each student to figure out what's going to be best for them. Some students really benefit from what we call talk therapy, so just sitting down, talking through what's going on, validating, giving them ideas, tips, things of that nature. Other students like to process different coping strategies that they could try during their own time. Other students want to practice mindfulness or go through kind of a meditation or deep breathing together in our office. So we really kind of work to get to know the student and figure out what is going to be the best way to help support them in those moments. Classroom lessons, we go into the classes and work with teachers to provide different topics, such as, suicide awareness, stress management, things of that nature. We try to do as many PAC news videos as we can, so those are short video clips where a counselor will talk about just an upcoming idea or thing that students can be aware of. For example, coming up is the month of stress management, so we're going to focus on how to help manage your stress and different tips and techniques for that. That would go out in a PAC news segment, so all students would be able to watch and kind of access those resources. We also here at Eastlake have the common room, and I know that this is a room of some design in all the other high schools as well. It has beanbags, low lighting, tables, and it just gives students an opportunity to reset. Again, some of those times when students are having a big wave of anxiety or some other kind of big emotion, feeling really sad, angry, they just need a space to be. So they don't necessarily want to talk, they just want a space to be able to reset. And so we set up and design this room so students have that opportunity to be able to reset and hopefully then go back to the class. So for Eastlake, our process is students check in with Ms. Sonnenberg or Ms. Johnson, so the two women that sit at the front desk when we walk into counseling. They say, you're going to go to the common room, and then they come and bring us a timer for 20 minutes, so we know to go check out the students in 20 minutes. We then they're engaged in some kind of talk therapy, working through kind of what they're going on, or they're able to return back to class without needing that additional talk therapy piece. Occasionally students are feeling so overwhelmed or in a place that they're not able to reach that, and then they would reach out to home and see if they can get stuff. So that's been a huge resource for our school, as we're trying to provide a space for students to just spend a little bit of time alone. Another big thing that we do as school counselors and helping support our students in this area is to collaborate with other individuals. We always ask for the student's permission in order to do this, but for example, it could look like reaching out to teachers, giving them a heads up, hey, this student is going through X, Y, and Z. We share as much detail as we want to or as little. Please be aware of this, or share some things that might help them as they're trying to either get caught up or just to go to make it through class. You might work with reach out to family members if you haven't already been in contact with them. You might work with David to share and help figure out the best way to support that student here at Eastlake, and or any other outside agencies or counselors that student might be seeing to try to provide a really comprehensive level of support for the student. This is a really nice overview of your Eastlake counseling team. There are a lot of us, so there's 9 of us in total. So I've listed for you each of the counselors, our alpha breakdown is what we call it, so the students and families we serve is based on last name. You can see the breakdown is Jennifer Schwartz. She works with students with last name A through C-A-R-K, and her email address is listed there as well. Here's the next set of last 4 with the breakdown. And the last page of our counseling team, we also have David McHale, who's going to talk here or has already talked. He's our evergreen social worker, and he's fabulous. And Ms. Sonberg and Ms. Johnson are the women counseling secretary, counseling secretary, who help to bring students and help support them when they come in, especially when they're very overwhelmed. We are here to help you. We love meeting and talking with students and helping them problem solve or just being there as a resource for them during some of these really challenging times they might be experiencing. There's a link right there where Eastlake students can sign up to be your counselor. Each counselor has their own sign up. You just click on it and say they want to schedule a meeting, and then we ask parents or you to email us directly so we can help you set up a meeting if that's something you would like to do. All right, and then really briefly, I have a slide for each of the other high schools in the area, since I know we might have some students and parents from these neighboring schools. Each school works similar but a little bit different in terms of how they handle their appointments. So for Redmond High School, here's a breakdown of all the counselors. When you click on the arrow, you actually go to the Redmond High School counseling website. It takes you directly to their email as well. And you can click on that link there, parents and students to schedule your own appointment. So they have a direct link to book their own appointment for students and families. Juanita High School, there's a list of the breakdown of counselors for their team. They have a link for students to sign up for individual meetings, and they have the parents and guardians send the counselor a direct email to schedule a parent meeting. Like Washington High School asks all students and parents to email their counselor directly to set up an appointment, and here's a breakdown of their caseload. And then Tesla STEM, they have a sign-up link for students to see their counselor, and they ask for parents and guardians to email their counselor as well to set up those parent meetings. Again, we are here as a resource for students. If you ever have any concerns about your students, you want to talk through some different issues, or just make us aware of things that are going on outside of school so we can help better support them in school, please don't hesitate to reach out to your school counselor. Thank you so much.
So this closes the portion of presentations. I just want to remind you guys here that we are recording this, so if you have friends or families that you would like to have see this, we will be posting this on our PTSA website in the next few days. We will be incorporating all the slides that you have seen as well into a place where you can come back and review them if you weren't able to capture some of the information. So I just want to thank you all for listening to the presentation. So now let's begin some question and answers. We have a microphone here at the front of the stage if you have questions that you would like to ask any of our panel members. We're here. We have probably 15-20 minutes, and so we can take as much of that time as we want, and if you don't have questions, I think maybe that's great, but we are here, and just feel free to ask away.
Okay, my question is about the screen time. Is that not more than 5 hours? So that means it's after school, right? Because now students all use the school laptop at school. But I think for kids sometimes it's hard because they finish homework by using laptop and doing research. So how can parents do super better and control that? I didn't talk about cell phone because without cell phone, the kids can still use the laptop, through the laptop, can still communicate with their friends. And I think I hope I have some suggestion to parents how to handle this. Thank you.
Yeah, that's a big topic there, and I know you aren't the only one. We get that question a lot. Screen time is a hard one, even for us adults, to make sure we aren't on screens too much. The 5 hours that was posted there on our presentation, that is incorporating all types of screen time. So that is supposed to include screen time towards work, towards studying, towards class, towards socializations. And we know that it's not always what's going to happen every day. We know that a lot of times we are on our screens more than that to work or get some other things done. I will say that, as a parent, try your best to encourage your child to socialize outside of screen times. There is going to be some, hopefully not more than 2 hours of social screen time. And so maybe after school screen time, not more than 2 hours. If they are coming to you saying, but this is how I'm talking to my friends, this is how I'm, wanting to do this or that, again, try to get them involved in an extracurricular activity. Try to say, hey, I'm going to drive you over to your friend's house for an hour. Would you like to do that? Try to find ways to encourage the social connection outside of the screen.
That's really, and that's really what we're trying to emphasize, just as a whole, even the American Academy of Pediatrics, is to not just do socialization via the screen, because it's really easy to text or Snapchat or all the other ones I always forget. But we're just really trying to push that in-person socialization, especially since the pandemic. We have seen a big drop in that, which we are trying to these mental health challenges. So that's really the biggest thing is, get them out of the house and socialize.
Everything I read about teenagers and my own experience with my daughter suggests that the more I told her that, these resources are available for you, seek them when you need them, the less likely she is to actually, use them. Just because, teenagers like to do whatever the opposite of what their parents tell them. With that in mind, what is the responsibility of parents? How can I help my daughter leverage all these amazing resources you can give them at home?
Another great question. I And I recognize that parents do have that challenge of their adolescent not always wanting to listen and maybe not always finding your advice to be the most useful. I do think open communication is important. Do have that conversation as to what resources are available. Don't be pushy about it. Just let them know what is aware and keep the conversation going. If you can find ways to kind of sneak it in, that would be great. You know, maybe you turn to the school counselor to maybe bring up the discussion, or you bring up the discussion with another peer, and try to get the communication going between peers. Because, like I said in the presentation, you know, they are more likely to listen to their friends than they are parents in often cases.
And I think that's why on the back of their ID cards, having all of those resources is also important, because their peers know about it. And so if they say anything or mention anything, their peers also know where to guide them as well. So
I was going to add to that too a little bit, and so I'll second the idea of maybe reaching out to the school counselor. And every family, you know, parent-student dynamic is different, and what your child experiences as an 8th grader might be different than as a 9th grader, and different as a 10th grader, and maybe there's a couple of years where you're not the one that they want to listen to, but maybe they grow back into that, and you know, and that's normal. But when it happens and what situations could be different from family to family. But maybe, yeah, one idea is to call or email the counselor and say, hey, trying to have my child understand this, or learn about this, or remember this, and maybe, you know, can you send for my daughter and talk to her for 10 minutes about this, and she might listen to you. Or maybe if you know the parents of any of her friends, then maybe they won't always listen to you, but hearing from a different adult, maybe they would. Or maybe if, depending on the topic, if your daughter's with, you know, 2 or 3 friends at her house, maybe that's different dynamic, and you can say something, and a couple of the other kids might start nodding their head, and that might cause your daughter to think about it differently too.
I know I said I'm not an expert on mental health, but I do have 3 kids. And one of the things, my youngest is 17, so I've got a 21-year-old, 23-year-old, and one of the things I really make sure that I'm paying attention to is when my kids come to me, sometimes your kids will decide when they want to talk about something, and I would just say, just be really aware of that, and be, you know, listening, and be open to change your schedule or what your priority was maybe for that moment. I think I found that those moments can be really, you know, like letting them take the initiative, and then paying attention to the fact that they are reaching out to you. And, you know, my 17-year-old is a night owl, and sometimes I'm so tired, and he's like, all of a sudden he wants to chat about something, or he wants to spend time with me, and I will like stay up later than I might normally, because I realize like this is a moment when he's open and accepting to wanting to communicate with me, and so I guess that's just the tip I would want to share.
I'm going to add a little bit to what Katie says, and I'm going to come from it from a parent of 3 as well. We have at our household a phrase that says, I'm using my courage. And that is just a phrase that we put out there so that if kids have something they want to say, if they start with that, 1, I know I'm going to stop, and whatever I'm doing, I'm going to pause. And 2, I'm just going to listen. We also have an agreed upon rule that if they state, I'm using my courage to speak whatever it is that's on their mind, we agree that in 12 or 24 hours, we will come back and visit that. And we won't have the conversation initially unless they want to have the conversation. But typically what it is just so that they can inform or to let you know, and emotions can go to the side so that we can think it through and then have conversations. Now, they don't always use it. It's just something that we put out there. But every now and then they'll come up and they'll say, I'm using my courage. Or every now and then their friend might come up and say, I'm going to use my courage. And it's just putting that out there that that's an option. So that way, when they're ready, if they're ready, they can then have a conversation. I model it sometimes by saying that to my children. Kids, I'm going to use my courage. I'm having a struggle with this. I just want to let you know. And sometimes it's that reversal where it's showing your child that you have a respect for their opinion and that you want to also model that sometimes things maybe don't go so well as much as the way you would plan it as an adult, so that they can recognize, okay, maybe this is normal. Things don't always have to be the Instagram perfect of what this world is. So that's just another option I'd like to put out there, just from a parenting standpoint.
Yeah, hi, thank you for the presentation today. I have a quick question about use of AirPods and listening to music while studying. Like our older one likes to have it all the time. I'm not so sure, like world history or something, and listening to music at the same time. So it's always a dilemma, like what's the right thing to do as a parent?
I'm going to give you a very great answer. Every kid is different, right? And so some kids can utilize music as a coping strategy to help focus and stay attentive. Other kids can find it very distracting. And so depending on the child, I always also recommend music without lyrics, because sometimes when you start singing along in your head and not really recognizing it or realizing it, and so doing the acoustic version of their favorite songs or something, or classical music is always really good. But every kid is very different, and so if they're getting distracted by it or they're not being as efficient with their time when they're utilizing music, then those would be times where I would say, okay, maybe we need to turn the music off and focus.
Yeah, it's not like it distracts or something, it just has to be parent. Like, how can you be constantly listening and so I don't know exactly what it's like. He thinks it needs it, it's helping, but in my mind, I don't know, like you're listening to a song, but also you are reading.
Yeah, and everybody has different learning styles, right?
Okay.
And so that's kind of the biggest thing is, you might need, very, quiet in myself as well. But I think that this generation is very used to excessive, background, that sometimes it's actually really helpful for some kids. Yeah.
Thank you.
Yeah, I would think maybe think about your child and is the homework turned in on time in general? Are the grades what you would expect and hope for? And as the kids get 9, 10, 11, 12, as they get older, then like maybe the first half of 9th grade, you should check skyward pretty often and see how are things, and then maybe things are at your comfort level, your child's thriving, succeeding, doing great, and the grades and the homework are what you hope for, then you can back off and check less often. But if they aren't, well, then you can start maybe asking questions and try to diagnose the problem. But maybe if the grades and the homework are all good, then maybe the music's okay.
I was wondering, are the kids getting back to quote normal after COVID and adjusting, or are they still camping out in the mountain?
Well, I think mostly normal in most ways, but not everyone in all ways. And I think the bathroom and the hallways are a lot better than they were. But like we heard earlier, like the resiliency, that's not where it should be all the time. And some of the learning too. And Eastlake, our test scores are higher than most schools, but I think they're not quite as high as they were a few years ago. And last year I supervised the math department, and every time I would talk with the math teacher to get ready to do, we have a formal observation process, and I ask how things are. The teacher would always lead off with, well, this year, this class I'm teaching Algebra 2, and for this class 2 years ago, they were in Algebra 1, and here's how that impacts this right now. And every teacher did that. They would say how the learning loss of a couple years ago impacted the learning that should be taking place now. And so we're mostly out of that, but we're not all the way out of that. I think the adult adults are rebounding quicker, and most of the students are fine, and maybe they always were, and some are not quite there. And I see that in the resiliency and the emotional maturity of some of the kids in some situations where there could be something that doesn't seem like it should be that stressful, but it sure feels stressful to the student right now. And I wonder, you can never know, but I wonder, is that from how hard was that 3 years ago for you? Or is it something else? And you can never know for everything, but I think it does still impact some of our kids, yeah. But bathrooms are cleaned up.
Is there anything that we as parents should be doing to help?
Well, and again, it doesn't, it's not always easy for a couple of years in every family, but as many open and caring conversations as you can, and be ready to listen. And listen to this. I was thinking, my own daughter, when she was an 8th grade student when I was becoming a teacher, and she kind of told me, she was in her words carefully, like she was happy for me and my hopes and dreams, but please don't apply to her school to be a teacher, And a couple years later, she told me it would be okay. And I think that's kind of fits every family in a way. There's a couple of years where they're learning what kind of person are they, and what parts of you do they want to be like, and what parts of you do they want to be different, and what do other people, their friends, have to say. So it's hard for a couple of years, but it shouldn't be hard always for a bunch of years. And just ask questions and maybe try to ask open-ended questions and not the yes/no questions. And not only are you happy at school, but what makes you happy at school? And something like that too. But like Katie said, be ready to listen, because they may not want to talk when you ask a question, but it might hit 3 days later, they have something to say, and they want to say it to you. It's the teenagers are unpredictable, but they usually keep coming back, but not always when we think they will. And also, if you know that you're going through a time where there isn't as much extended responses to your questions as you would like, or you have something you're worried about, you can send an email to all the teachers. And when you go into Skyward, when you look at their classes, you'll see the teachers' names are hyperlinks where you can email them. And I think there's one button where you click it and you can email all the teachers at once. But just say, hey, start to wonder, how's my son, how's my daughter doing, and anything I should worry about or know about, and just see what they say.
I think I can follow up on that. One of the things I noticed in the presentation was it looked like parents are underestimating the level of their kids' distress. Like if you just look at the percentages, that there was 30-some% of kids that were depressed, but parents were saying about 12% of parents were reporting that, which is concerning that we're that out of sync, I guess. And so I wonder, as practitioners, David, for you in schools, what are the things you think we're missing? Like, what are kids reporting that maybe parents, that we're missing, that we're not connecting on to realize when they're distressed?
That's a good question, yeah. I think something that's been touched on a lot tonight is waiting for those moments when your kids might approach you. I think sometimes I hear from students when I'm meeting with them, just like miscommunications that happen between them and their parents, and maybe there's other things going on in each of your days that make it hard to communicate and talk about issues. And I think at this age especially, kids are turning to their peers maybe more than any of us or adults, or looking to people who they can kind of trust. And so I think just providing that consistency and that genuine interest and that availability to talk with them gives them a sense of like, oh, I can turn to you. And they may know that, but just there's so much going on in their lives. But I think that's one of the things is a lot of times students don't know, who do I turn to? And even if we all have a very friendly, approachable demeanor, like sometimes even just the idea of bringing up that they're struggling. I have this conversation often where student might be struggling and they're thinking like, oh, my teacher probably like hears this a lot throughout the day from a lot of students. There's a lot of students at Eastlake that probably kids have it worse than me, and just kind of validating that like everybody goes through different struggles, everybody experiences those struggles differently, and you're no less deserving of help or assistance than anybody else. And I think starting at that place and just helping them realize they deserve help and assistance, and then opening that a little bit more and just saying, here's all the resources that are available to you, kind of planting that seed. They may not respond to it right away, but maybe later when they're having a hard time, they might think, oh, I can turn to my parent or my counselor or my teacher and ask. And yeah, I think just that piece of like social connection and knowing who to turn to, I think, and giving them the tools, because it's hard to talk about mental health, giving them the tools and the language to identify when they are struggling is a lot of what I see from students is just that language, having that, knowing who to turn to.
Thank you.
I think I can add to that a little bit too, and I was thinking a related thought, and I guess what I'm thinking is beyond just mental health, but maybe talk to your students, talk to your kids when things are okay even, and ask them questions like show you care by asking questions like, what would you do if you were in a car with friends and the driver had a couple of drinks? And if you can have conversations like that when they're not in the middle of that, then if they are someday, then maybe they'll have thought through it, but also you'll have already shown that you care. And maybe they can talk with you. And if you tell them, if they get in a situation where there's friends and risky behavior or something, they can always call you and you're going to help with and it's not about punishment, but it's about a ride home or something, then they're going to be more likely to talk with you when if they need to, because going from ninth grade it's not a lot more freedom than eighth grade maybe, but 10th grade they all start driving and friends do too, and they have more freedoms in those families and more ability to do things, and so they can learn some of how to navigate this from their friends or from you or both. But if you start talking with them before they're in the middle of some kind of hot water, then they're better able to navigate that when it does happen.
I guess if I could, I'm aware of time, but I wanted to have two comments and ask a question. So first comment is really a praise and a thank you for all of the panelists' time and parents too for coming out. This is a topic that's near and dear to my heart. Second comment would be sitting here as a parent of a incoming freshman last year, kind of blown away by all the resources I heard about tonight and the fact that I didn't know about a lot of them. So consider adding a bit more of this part of we got to see who the counselors were at the beginning of the year, but not knowing that all of these resources are out there as a parent, I think that'd be really helpful. And I guess the third is kind of a question that has been kind of burning in my head of seeing the commitment to addressing some of these mental health challenges that we've got in our society, in our school, in our community. I appreciate having all the resources. One thing I want to hear back is kind of some of the frustrations and particularly maybe the limitations, and this would be David and Todd, maybe two could answer. We've got HEPA laws or privacy laws. What are the mechanisms, I guess, for the school and counselors to communicate back to parents and addressing what are we missing? How would we know what we're missing? I'm not sure what the question is in there, but what are those barriers?
Well, I guess that question can go a lot of directions. Let me speak to something you said first, like you're hearing about some things that we do or offer that you didn't know about. And like I said, our school has goals every year, and I'm working on that with staff now. But one goal, I'm just tailoring it, but it's basically we do offer many interventions and resources and supports but we're so big and spread out, there's no one person who knows everything we do, even among our staff. So I want to find ways to communicate what we do and evaluate some of what we do, and so that students and parents and teachers know more than they do now. And because sometimes I think it's not that we need a new program, we need more people to know about our programs. So that's on my mind. For what we do, if how much the parents know or can know, that sometimes with counselors, there are laws that stop even parents from knowing the details. And sometimes even for staff, if sometimes I can compel a student to talk with David if I know of a situation that necessitates it, but then, and I can go to David and say, well, have you talked with this student? And he can say yes, but I can't say, well, tell me all about it, because even for me, that might not be something that David can share with me. But the same for parents, and some of what the school counselors say, and most of what David says, he wouldn't be able to share with you. But almost all of the rest of us can. And that didn't answer everything you're asking about, but tell me again, what did I not answer on that?
Oh, I think that answers a lot of it, but maybe this is really back to David, and right, if you're in a counseling situation, particularly with mental health, once a student child's 13, they get to control that flow of information. I'm aware of that. If a student came to you, they're in distress, what mechanisms do you have to let the parents know?
Yeah, so that's one of the first things I go over when I start meeting with the student is that right at the age of 13 they can consent to their own mental health care, and I kind of explain that I operate from the rules of the hospital, which sometimes differ a little bit in what I can communicate from what the school might be able to give in terms of information, but I'm very clear about the exceptions to that confidentiality. And so I explain that while I may not be sending, daily emails to parents or letting them know every time we meet, there are times when I do have to notify someone, a parent or guardian, that a student's safety might be in jeopardy. And so in those situations, I usually if it's an emergency situation, I'm calling a parent right away. And I think the conversation I have, and the foundation I try to lay with students is that they do have a free space to talk, and I'm not sharing everything that they share, but part of the reason why there are those exceptions is to keep them safe. And so I try really hard to have conversations with them about, okay, here's what I know, here's what I have to say, and would you like to be involved? There's been a lot of times where I've sat with a student and called a parent, and they might be really nervous to share about what's going on, but we've had some really productive conversations together. And that way the student has a voice in what they're saying and what they're conveying, what their needs are. And so it depends kind of on the level of communication. Always if there's a urgent safety concern or immediate safety threat, that would be a time when I reach out directly to parents, whether or not I have permission. But then there are some ways to kind of build that capacity to communicate. Like we've been meeting a few times and this is coming up and maybe this is something happening at home. This might be a good time to loop in teachers or parents and kind of help them see like how that could be a benefit to them, to get more people kind of on their side and knowing more about what's going on. So does that kind of address some of what you're asking?
Yeah, it does.
Okay.
I could share a little related information, not directly related to your question, but close. There are some other conversations that we have where it's important to us, like if a student is in a residential treatment facility, whether it's for substance abuse or a mental health challenge, then when they come back, we meet with them, and often David's in the room, and we have a school safety plan that we develop, and we talk like okay, are there any triggers that's likely to lead you to crisis, and what are they, and do you know what they are, and what adults in our school do you trust and can you turn to, and what students, and what will you do? Do you recognize it if you're having crisis, and sometimes there's a signal. We have a card that a good number of our students have where if they set it on their desk and leave, the teachers know, okay, they're going to the counseling center right now, and they don't have to talk about it in front of 30 other students. So we have some of that in place, and also, which doesn't directly relate to mental health, but sometimes substance abuse is related, and something I think most parents don't know is if we have a student where there's alcohol or drug possession or use at school, then we can't mandate that they talk to our drug and alcohol counselor. But we do have a couple of tools in our toolbox. So far this year, there's been 4 students who've been very drunk on alcohol. And around here, vodka is the drink of choice. It's easy to steal from Safeway, and it looks like water. But the problem is if you're 15, you don't know what 8 ounces of vodka is going to do to you 30 minutes later. And so it's not like 1 or 2 ounces of something. It's like ambulances are called, and that's happened 3 times with ambulances, and 1 more where it was close to that this school year. Not during the school day, but at ball games after school, and where there's been maybe several hours of unsupervised activity, and with the Safeway, it's not often that there's like a friend that's 21 or over. It's shoplifting, and my understanding is our Safeway just around the corner has more alcohol theft than any other Safeway in the region. I don't know how large the region is for this Safeway. I don't know if it's part of the state or several states. I don't know. But also the alcohol sales are greater than any other, so they don't want to make it harder to access than it is because it's a moneymaker. But vodka is like a Bellevue School District right now. There's cocaine here. It's vodka for what parents should know about. But if they have it or use it at school, then if it's the first time, then we say, okay, you have a 15-day school suspension. It's 3 weeks. But we're going to reduce it down to 5 days if you go see our drug and alcohol counselor and do everything she says. And then every student does that. So we can't compel it, but we kind of do. And then when she has an interview and an assessment, she's looking at how much is this a person who doesn't know much and doesn't have much experience with whether it's alcohol or a drug, or is this someone who's got a real problem here? And then there's 2 tracks that she tells them to do, and one is 2 hours on a Saturday, and that's for an inexperienced user, and the parent must be with that student for that 2-hour session. But if it's more of a chronic user of a problem, then there's something like 6 or so once-a-week sessions after school in the early evening, and the parent must be part of that too. And if the student does all that and agrees to it, then we say, okay, you have a 5-day suspension, but we're going to keep track of this other 10, and we're going to check with our drug and alcohol counselor, and you really do need to follow through, or these other 10 days are going to come in. And in recent years, we haven't had to do that, but that's how we approach that, and parents are aware of all that too.
Okay, I think we have time for 1 more question.
Yeah, thank you all for an excellent and very informative session. I learned a lot from today. I want to know what level of patience should like parents like me should have dealing with 13 and 14 years old.
What level of patience to have?
Yeah. Like example, I go to my daughter and I wanted to speak something, and she starts speaking and she'll go on non-stop. The final result is whatever I want to say, I will be telling her. She'll just say what she wanted to tell and she'll just go away. So I just don't know what level of patience should parents have dealing with such situations. And one more example is if she has any classes like basketball games or any art class, I'll be the first one sitting in the car, and I have to wait for her like 5-10 minutes, and then she'll come slowly. And she keeps on apologizing, sorry, she'll keep on going. I say, okay, that's fine. But also she won't stop. Again, after 10 minutes, she'll say, I'm so sorry, I won't do it again. So I just want to know what is the level of patience we should have dealing with such situations.
I think there's no simple answer. I think every family is different for the dynamics, for the expectations, for what's normal and what's not. Maybe part of it, my answer could be that, like with the AirPods, you could maybe send an email and to the teachers and see, how's my child's behavior and interactions in the school with peers and with adults, and if you're hearing good news, then maybe this is that temporary couple of year phase where it's just hard to line, and maybe you can run a little bit if it's okay elsewhere. But then you have to think of for yourself, what are you willing to put up with too, and what kind of accountabilities are going to be, and maybe if she's chronically having you wait in the car, then maybe you just drive away at some point and say you got tired of waiting and tell her you'll be back in a half hour. Maybe that's, depending on the time and the setting, maybe you're okay with that once and she can think about that. But if things are okay in other situations outside of the family, then maybe this is that, it's hard to be a parent of a 14-year-old sometimes. But I think it's just different for every family too. But if that's the greatest challenge you see, and I think you're doing okay.
Thank you.
I want to thank each of you for coming this evening. I'd like to thank our panel for speaking and taking questions as well this evening. I'd also like to thank our PTSA presidents, Julie Kotler and Laura Hamilton, for helping set this event up. I'd like to thank Tay Thomas for setting up this venue. I'd like to thank Lucas Ferrato for filming this event so we can post it online for families who weren't able to make it. And I would also like to thank Julie and Laura because they will be adding the slide decks that were presented this evening to that as well for our families. I wish all of you safe travels home, and thank you for taking the time to come today. So thank you. I also want to remind you there are resources out on the table for you to take home and to access and to look at. So don't forget to stop and look at those. So thank you very much.